and the left subclavian artery behind, and the left subclavian artery behind and lateral to the left common artery. Right and left brachiocephalic veins, right and left brachiocephalic veins are all large vessels that are passing through the inlet of the thorax. So it is important to you to learn it step by step, structure that are passing through the inlet. Viscera is the first, and large vessels second, and small vessels are third part. So let's look at the small vessels at the inlet of the thorax. Right and left internal thoracic arteries. Here in the posterior aspect of the cartilage we have two small vessels called internal thoracic artery in the right side and in the left side, internal thoracic artery. And right and left superior intercostal arteries, right and left superior intercostal arteries are second part of the small vessels that are passing through the inlet. Right and left first posterior intercostal veins. In front of the posterior intercostal arteries we have two small vessels called first posterior intercostal vein that is between the sympathetic trunk and the posterior intercostal artery. And the last one from the small vessels that are passing through the inlet is inferior thyroid veins. Inferior thyroid veins that are lie behind the thymus and in front of the trachea. And the fourth section of things that are passing through the inlet are nerves. So nerves are in yellow color in inlets. You can see here in the right side, in the left side, in the anterior side, in the posterior side we have a lot of nerves that are passing through the inlet. One of them is right and left phrenic nerve. We have a right and the left phrenic nerve. Right phrenic nerve is located in front of the lung and lateral to the right brachiocephalic veins. And the left phrenic nerve is located between left subclavian artery and left vagus nerve. The second nerves that are passing through the inlet are right and left vagus nerve. Right and left vagus nerves. Right and left vagus nerves are located between and behind two structures, brachiocephalic and brachiocephalic veins and brachiocephalic artery in the right side, and back and between left common carotid artery and left brachiocephalic veins. This triple structure called one of the important things and vessels and structure in the neck. So we have a phrenic right and left and vagus right and left nerves in the passing through the inlet. The third nerves are passing through the inlet are right and left sympathetic trunk, right and left sympathetic trunk that are lies in the posterior of the inlet and lateral to the head and neck of the ribs. They are in front of the first posterior intercostal veins and behind the lungs, and it's plural. And the last one of nerves that are passing through the inlet are right and left first thoracic nerves as they ascend across the first rib to join the brachiocephalic brachial plexus. first thoracic nerves that are here, located here, behind of this structure, neurovascular structure here in the medial border of the ribs. Is the first thoracic nerve in the right side and the first thoracic nerve in the left side. If you look at this picture, we have an extra one nerve here in the left side that is called left recurrent laryngeal nerve. Actually, left recurrent laryngeal nerve is a branch of the left vagus nerve that's its back to the neck. It's very important nerve that's enter to the pharynx and innervates the muscle of the pharynx and larynx. So in the last section, in the last part of the structure passing through the inlet of the thorax, we have muscles. The muscles that are passing through the inlet of thorax are sternohyoid, here sternohyoid, and sternothyroid, and longus coeli in the back. So we have two muscles in the right side and left side called sternohyoid and sternothyroid that are located between the posterior part of the manubrium and the anterior surface of the thymus. And the muscle called longus coeli that is located back of the inlet of the thorax between head of the ribs and the body of the vertebrae. So there is one question about the ribs and inlets of the thorax. Is there any abnormality in ribs in inlets of thorax? The answer is yes. In a clinical anatomy, we have a term like cervical rib and a syndrome that called thoracic inlet syndrome. A cervical rib that you can see here in this picture, a cervical rib is a rib attached to vertebrate 7 cervical vertebrae. It occurs in about 0.5% of subjects. Such a rib may exert traction on the lower trunk of the brachial plexus, which arcs over the cervical rib. Such a person complains of paresthesia or abnormal sensation along the ulnar border of the forearm and wasting of the small muscle of the hand supplied by segment T1. Vascular change may also occur in this abnormality. In contraction or narrowing of the aorta, the posterior intercostal arteries get enlarged greatly to provide a collateral circulation. Pressure of the enlarged arteries produced characteristic notching on the ribs, especially in their posterior parts. The thoracic inlet syndrome is another abnormality related to the ribs. Thoracic inlet syndrome, in fact, two structures arc over the first rib. Here is the first rib and here is the second rib, and two structures usually arc over the first rib, the subclavian artery and first thoracic nerve. These structures may be pulled or pressed by cervical rib or by variations in insertion of the scalenus anterior. The symptoms may therefore be vascular, neural, or both. Well, in this slide, as you can see the pictures from the anterior and posterior of the thoracic cage, we have a very important structure in the lower border of the thorax called diaphragm. In other words, inferior